Hi everyone, this is Dr. Raman and welcome to the YouTube channel fmge with Dr. Raman. This video is the continuation of the intestine part 2. In this video, I'm going to talk about the how to read the intestine chapter proper. Okay, so when we start to read the intestine, first we read about the the obstruction, intestinal obstruction. What is the cause of intestinal obstruction? How we deal with this intestinal obstruction? What is the clinical feature? What is the X-ray? X-ray is also very important in intestinal obstruction. So first we have to know the clinical feature of the intestinal obstruction, their X-rays, their treatment is very important, and the cause is very important. Okay, in cause you have to know about the adhesions, how to deal with the adhesions. Second is the bowel atresia. Bowel atresia we have to know about the duodenal atresia. We have to know about the jejunal atresia. Images question is also going to ask in this from this chapter. And then you have to know about the some pediatrics topic like intussusception you have to know. Okay, Meckel's diverticulum you have to know, meconium ileus you have to know. So these three from the pediatrics you have to know in the obstruction chapter. Then you have to know the strictoplasty, the type of strictures formed like in case of the burns injury, acid injury, the during the some kind of like in case of TB, uh, intestinal TB as well. So this was all about the obstruction when we study the obstruction. Okay, and as we move further, we will see some topics from the small intestine, some topic from the large intestine. In the small intestine, we mainly see about the small intestine bacterial overgrowth, that is known as the SIBO. Okay, then we know the short bowel syndrome. You have to know about that also. Then you have to know some kind of fistula, not fistula, the what to say, uh, the stoma formation. Okay, the type of stoma, like with the ileostomy, we have the colostomy as well. So you have to know about the type of a stoma, how we create a stoma, and from a stoma image based question is also asked. So you have to know the image based as well. Okay, and as we move further in the intestine, you have to know about the IBD, inflammatory bowel disease. It is very important. Crohn's disease and ulcerative colitis. You have to know everything about the, even the treatment part is asked as well in the IBD. Okay, and after knowing the IBD, you have to know the mesenteric ischemia. Okay, mesenteric ischemia type of, like we have the arterial ischemia, we have the venous ischemia. So you have to know about that. Even there, the clinical feature is asked so many times, in the clinical scenario. So you have to know that. After knowing that, you have to know diverticulitis. Okay, diverticulitis and diverticulosis, how to differentiate between the diverticulitis and diverticulosis. And they are barium image question asked most of the time, and their CECT image is asked also as well. Investigation of choice is asked very frequently from the intestine chapter. So you have to watch upon the investigation of choice treatment, like we have the colonoscopy, proctoscopy. So this you have to know. And this so many time treatment is asked as well in the intestine. So this intestine is, the the 50% from the abdominal surgery. So you have to read it very properly, and go with the PYQ. We will see in the next video. In that we'll talk of some kind of the cancers and the rest all the topic from the intestine. Thank you guys. Bye bye.